Warning, never get this test. In this video, I'll reveal 7 dangerous tests that can lead to false diagnoses, create imaginary illnesses, and even cause you to treat conditions you don't have. You might end up taking meds with side effects, harming your health without any real benefit. This is a serious topic. As an endocrinologist, I'm alerting you about 7 risky tests. In my daily practice, I see many tests ordered and done without proper criteria. So what are these 7 dangerous tests that can lead to serious mistakes? The number 1 test is the insulin blood test. Now you're probably thinking, why is this test dangerous? What harm can it do if you have no symptoms? Many people request insulin tests to check for insulin resistance, but there's no scientific evidence that this test helps in this situation. Why? Firstly, pre-diabetes and diabetes diagnoses are made using other tests. The insulin test isn't part of diagnosing diabetes, so it's not useful. Secondly, insulin test results can vary greatly. It can change hourly, even minute by minute. So results can be falsely high or low, depending on when it's taken. It's not useful for routine screening, despite common practice. So when is the insulin test actually useful? When we suspect an insulin-producing tumor called an insulinoma. So when a patient has low blood sugar, we measure insulin to check if a tumor is overproducing this hormone. It's useful then, along with other tests, to make connections, but the insulin test is mainly done when we suspect excess production, like with a tumor. And why is it useless in other cases? What do people usually say? I know the arguments. Many lack scientific validity, while others have minimal scientific backing, basically negligible based on low-quality studies. Those who arbitrarily request insulin tests say, I'm ordering it to warn the patient they might become diabetic. But this care in diet and lifestyle should be applied to everyone. Don't wait for abnormal test results to make changes. Stop eating processed foods and refined sugar daily. These recommendations are for everyone, not just those with altered test results. This comes from old medicine that only treated diseases after they appeared. So people used to wait for problems before adopting healthy habits. Now we do the opposite. We adopt healthy habits first to prevent diseases and abnormalities, okay? Did you understand the insulin test explanation? Let's move to number 2, which worries me as it increases death risk. I'll explain everything now. This test is carcinoembryonic antigen, or CEA. It's a tumor marker. Heard of it? Why shouldn't this test be routine? It can give false positives. What's that? The test may be high without a tumor. It's mainly used for colorectal tumors. It causes confusion. Patients think they have cancer when the test is high, assuming it's the tumor. But other factors, even flu, can raise this CEA tumor marker. Smoking can also increase it. Many things can falsely elevate it, so it's not for routine screening. Also, many intestinal tumors, even colorectal, don't raise this marker. So even if you have cancer that doesn't produce CEA, it won't show up in the test. Therefore, there's no point in doing it routinely. How should screening be done? With colonoscopy after 45 or earlier, if you have a family history. Some genetic syndromes greatly increase the risk. Then colonoscopy screening is done earlier, but not CEA testing. Got that? And why might it increase the risk of death? Because it can give a false sense of security. People think the marker's negative, so I'm fine. When in reality, you should still get a colonoscopy. That's the recommended screening method, okay? And many people end up relying on this. Patients ask me for tumor markers daily. I'm focusing on this one, but there are many others to discuss. Oh, I want to know if I have colorectal cancer. So the person goes and asks. Sometimes the doctor doesn't fully understand how it works, orders it anyway, and you end up going years without doing the exam that really matters. When you finally discover you have cancer, it's already advanced. It could have been prevented, as colonoscopy can remove polyps before they become cancerous. So in many cases, it can prevent colorectal cancer. This exam is crucial. And number 3, this exam also worries me. You can see all these tests worry me, right? This topic is very serious, as I mentioned, which is the thyroid antibody test called anti-TPO. But why shouldn't this test be done routinely? Because this anti-TPO or antithyroid peroxidase test is positive in about 20% of the general population who don't have any disease. Often, when routinely requested, elevated results cause intense worry in patients. I talk to people with high anti-TPO daily who seek my help. I reassure them if other thyroid tests like TSH and free T4 are normal. This test alone doesn't dictate treatment or medication. As I mentioned, for 20% of people, this test is normal and has no consequences. In some cases, high anti-TPO can indicate Hashimoto's thyroiditis, an autoimmune attack on the thyroid. This test should be requested when Hashimoto's syndrome or thyroiditis is suspected. Then it's useful. I often order this test for diagnosis, not for people without Hashimoto's or hypothyroidism symptoms. Got it? So it's not a routine test. It can cause worry and lead to unnecessary tests or even medication you don't need. And test number 4, this one here, you probably know it, the IgG food allergy test. The American Allergy Society has stated it lacks scientific validity. There's no evidence proving this test can dictate treatment. You might test positive for many foods you're not even allergic to. These foods don't need to be cut from your diet, okay? If you suspect an allergy, there are better tests, like skin tests, which are far more reliable than the IgG food allergy test. European societies also agree there's no scientific evidence supporting it. Got it? I always like to say this video isn't opinion-based, but based on scientific evidence. This test can be very confusing. Why? What happens in practice? Someone suspects an allergy, takes an invalid test, and then restricts many foods, risking nutritional deficiencies. You're cutting out foods you enjoy and that are good for you, all because of a faulty test. See how tests can mislead us. So it's crucial. Why? Often people think a good doctor orders many tests without criteria. I've heard this often. Oh, that doctor is excellent. Why do you think they're good? Oh, they ordered many tests, even ones I didn't know about. Even lab staff thought the tests were too advanced. What a good doctor, they say. In reality, this shows the doctor's lack of experience and skill. It's quite interesting, isn't it? Number 5 is the cortisol test, which also requires great caution. The cortisol test is popular for detecting low cortisol or adrenal insufficiency, not excess cortisol, which most doctors mistakenly test for. Ordering a cortisol test for high levels can be misleading. Basal cortisol alone isn't reliable or scientifically valid for proving excess cortisol. For suspected Cushing's syndrome, we need to perform a dexamethasone suppression test. What's that, you ask? The night before, the patient takes medication. Then in the morning, they do a test to see if, even with the medicine, there's still uncontrolled cortisol production from a tumor. It's not just a case of, oh, I think I'm stressed. I'll check if my cortisol is high. This can lead to false ideas and confusion. Another test that shouldn't be done is salivary cortisol. Have you heard of it? It's quite trendy now. I get many salivary cortisol tests, but it's not useful for screening or routine checks. Why is that? Because cortisol naturally decreases throughout the day. It's highest in the morning when you wake up, then it drops. Many people do salivary cortisol tests in the afternoon or evening. It comes back low and they panic. Look, I'm cortisol deficient. Or there's a made-up diagnosis that doesn't exist called adrenal fatigue. What does exist is adrenal insufficiency. That's real. But adrenal insufficiency can't be confirmed with salivary cortisol. Got it? We use other tests to diagnose it, not salivary cortisol. Salivary cortisol can be used to confirm excess cortisol production. For example, if the first test I mentioned is high, we might request another test like urine cortisol or salivary cortisol. But in this case, it should be elevated, showing no normal reduction, not the opposite, to diagnose cortisol deficiency. This is very serious. Why? I see many patients taking cortisol diagnosed with adrenal insufficiency. Oh, I don't produce cortisol. They're taking cortisol, and what happens? It increases the risk of diabetes, high blood pressure, osteoporosis, and obesity. So the inadvertent use of cortisol is very dangerous. Actually, not cortisol itself, right? It's the hormone. You might take hydrocortisone, prednisone, dexamethasone, or prednisolone. It varies. Got it? Is that clear? So be very careful with these cortisol tests. Preferably see an endocrinologist who can better evaluate this, but you shouldn't do this routinely, okay? Especially without any symptoms. For instance, testing cortisol if you feel fine, with no signs of adrenal insufficiency or Cushing's syndrome. Excessive cortisol production has no proven benefits. In fact, it can cause harm, like the various diseases I mentioned. And number 6 is the prolactin test. Why shouldn't you routinely test prolactin? Because prolactin can be affected by many factors. Even mechanical or physical stimuli, like certain bras, can boost nipple stimulation and prolactin production. Printed shirts or physical activity in corridors can also slightly increase prolactin levels. Touch can raise prolactin. Many meds, like antidepressants and blood pressure drugs, can increase prolactin. Prolactin tests shouldn't be routine. When should it be done? For infertility investigations, for example, or if you have symptoms like milk discharge, low testosterone in men, or menstrual changes in women, doctors may suspect a prolactin-producing tumor. In that case, yes, it's well indicated, but why can it be harmful? Often it causes undue worry about prolactin levels, which are actually due to controllable factors like physical stimulation or various medications. We expect prolactin to rise, so it's not abnormal, but an expected finding. Got it? So what happens then? Besides the stress of high prolactin, it may lead to false tumor suspicions and unnecessary brain scans. It's tricky to do tests without clear reasons, you see? Do you agree with me now? You thought it was an exaggeration, didn't you? But it's actually true. As a specialist, I see this every day. Number 7, equally important, can have serious effects. Routine reverse T3 tests. Have you heard of reverse T3? What do many people claim? They say their thyroid tests are normal, but reverse T3 is high, meaning the thyroid isn't using the hormone well. But in reality, that's not true, okay? Reverse T3 is only needed in specific cases, like when we suspect euthyroid 6 syndrome. For hospitalized patients with suspected dysfunction, reverse T3 can increase and have clinical significance. That's why it exists, but it's not for routine use. Including reverse T3 in routine tests can lead to false diagnoses. I often see patients taking thyroid hormones due to changes in reverse T3, and I explain, you don't have any thyroid issues, your tests were normal. Taking thyroid hormones unnecessarily can be dangerous. It can make your thyroid lazy, shrink it, and stop hormone production. This can lead to serious issues, increasing the risk of arrhythmias and osteoporosis. It's a very serious matter. Tests have specific indications, and reverse T3 shouldn't be done routinely. Which other tests would you like me to discuss? I could easily list 10 more here that are also quite common. If you want a part 2 video, suggest it here. If you're unsure about any exam, I'll comment on its usefulness. Also mention which city you're referring to. I'm talking about Porto Alegre, where these exams are extremely common. Now, I'll suggest a video where I discussed pancreatic tumors. Did you notice that item number 1 was about insulin? Here I talk about the insulin-producing tumor called insulinoma. Want more information, signs and symptoms? Click this video for more info on pancreatic cancer. Take care. See you next time.